Another diagnosis that I deal a lot with is something called impingement, okay? Really what that means is, the way to think about it is pinching, okay? And that is when one of the bones in the shoulder, instead of being flat, where your shoulder works under it like this, you're born with it slightly hooked, okay? And over time, that can become pinching. It can rub on the rotator cuff, the tendons, and cause pain, sometimes even painful noise and stiffness, okay? So if someone has pain and stiffness, they're getting some pinching feelings, difficulty reaching for things overhead or behind the back, and it's not improving, it's important to get evaluated for impingement. Because if caught early enough, a lot of times that is not a surgical issue. So we can treat inflammation and get them from rubbing kind of back to this where it's not rubbing, okay, if we catch that early enough. Sometimes a combination of anti-inflammatories, a cortisone shot, good physical therapist can really reset a shoulder and avoid bigger problems. And you want to, because if impingement goes long enough, that rubbing can eventually cause rotator cuff tears. And then you get into that world, and that can be a different outcome. So it's important to get those symptoms evaluated sooner than later. Sometimes if impingement doesn't improve, if it's chronic and they keep getting the rubbing and the pinching, and we've tried non-surgical things, sometimes it's worth doing a minor arthroscopic procedure where I put a camera in and I take a burr, like a Dremel burr almost, and I can get rid of that hook and make it from hooked to flat. And that's a cure. That never comes back, and that kind of decompresses the shoulder and allows it to function normally. So if you catch these early enough, sometimes you can avoid much bigger problems, sometimes even avoid surgery. Acromial hooks come basically in 3 types: normal flat, or maybe slightly hooked. Type 2 is hooked, where it could eventually give you problems. Type 3 is really large and sharp. Those almost always end up with either a rotator cuff tear or bad symptoms where you come see somebody. So most people are pretty normal, but there are about 20% of folks have a hook or the big sharp hook. Physical therapy is very important in both worlds. Even non-surgical, I'll typically treat with physical therapy, stretching and strengthening. And it's important to maintain, because the other thing I tell my patients, and it sounds fairly obvious, is as we mature into our 30s and 40s and 50s and beyond, our joints and ligaments and tendons and muscles don't magically get stronger and more flexible. They get weaker and stiffer. And so if you fight that with a good stretching and strengthening program, you can feel good and last longer. But also post-operatively, when I do the minor procedure where I get rid of that hook, physical therapy is very important for about 4 to 6 weeks to get that full range of motion and strength back, and then someone is cured.